Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, I am here with my most tolerant co-host, willing to go through the paces with me on rhinoplasty once again, Dr. Millicent Rovelo.
Once again.
Here we go.
Here we go.
Because I'm telling you, like, this is something that comes up all the time, and if we don't update it, it sounds like, if you listen to the old podcast, it sounds like they're from like 1947.
Nope, no, like 2022.
They get outdated really quickly, and this was a request of my assistant, my executive assistant. She said, can't you do a podcast about what to consider, what you need to consider when you're thinking about having a rhinoplasty? Like, what are the factors? And I said, well, we've done that one. She goes, yeah, but it's like old, and it doesn't live up to what's going on right now. And you've changed a lot of things in the last couple of years. So thank you for doing this.
So you are most welcome. I am your most tolerant and only co-host. And I'm happy to be here to talk about rhinoplasty again with the new updates to make our assistants' lives easier. This one's going out to them. This is for them.
It is, because the patients do ask.
And the patients, by the way.
I mean, it's really for them.
And them too.
We're not just, slaves to our assistants, but at the same time, we want to be able to make it easier for patients to know what's coming. Why are you coming to this practice? Why do you, and even if it's not for this practice, a lot of patients around the country say they listen to our podcast and they use the information for their plastic surgery experience in North Carolina or in Boston or wherever. So we're happy to put the information out there and happy to help. So when you're thinking about rhinoplasty, and this is something that I've said over and over again, and I'm going to say it again right now, the way that you pick your plastic surgeon for rhinoplasty is you look at the before and afters and make sure you like them. That's got to be the first step. Because
first and one of the onlys. We've gone through this before. How do you pick them? You get your referrals from however you get your referrals. If you're listening to this podcast, you've probably already put together a list of people that you're interested in. And once you have that list, you go to their websites, you go to their social media, you look at their befores and afters, and then you go pick a few. And you go talk to them and you figure out, do you like them? Do you want to hang out with that person for the next year? Because you're going to be seeing a lot of them. And then you whittle it down to your person.
Yeah, and you do want to make sure that you like those before and afters, because you're
going to get a version.
You're going to get that type of a change. It's still going to be your nose.
Yes.
Like my practice is very customized, and and I have patients that come in and say, "Oh, I noticed that you do, a very gentle hint of a curve on most of these, young, teenage female rhinoplasties. Could you give me a little bit more of that?" I said, "Sure, of course we do that.
Sure.
Could you rotate the tip a little bit more? Could you leave the tip a little bit longer? I'd like a little less of this. I'd like a little more of that." And so it is very customized, and which is why we do the drawings, et cetera. And a big factor in my practice is I do artwork. I'm an artist, and I happen to do plastic surgery, but I draw the picture of what I think is the change is going to be for your nose. It's not your nose, it's my representation. I usually draw it, and the patients go, "Oh my God, that's really accurate." So this is what I can do, because I know what I can do to change their nose, and then I make the drawing. I find that the 3D imaging and the Photoshop doesn't make the changes, because it doesn't allow me to alter the light reflexes and shadows enough to represent the moves that I've made in their cartilages. So I like drawings.
Yeah, and you do a very good job. Your after drawing that you do, what you want that nose to look like after surgery, usually ends up being pretty accurate to how it ends up looking. But definitely patients do sometimes come in and they want to have that 3D vector computer imaging. And that's very practice dependent and surgeon dependent. In terms of how much they like it, utilize it, depend on it. But I think for patients, if they can get a good idea from you about what your plan is and what you want their nose to look like, and then they combine that with the befores and afters that they see on your website, they should be able to get a pretty good idea of what they will also look like afterwards.
Yeah, I've done like over 5,000 rhinoplasties, so the reliability is there. It's gonna be there.
Yeah.
You're not gonna get like some newfangled nose job that I just thought of over the weekend.
No, it'll be
a very reliable,
predictable result.
Yeah.
And so now that you've met your plastic surgeon and you've chosen them and you want to proceed down this path with them, what is the next step in planning the surgery? And what can you expect after you have that consult?
Well, I think a big thing comes up is financial, the cost.
That's a big one.
Yeah, I mean, it's expensive in Beverly Hills.
And that will perhaps factor into the different surgeons that people choose, because there is a wide variability in cost. And we do have a whole podcast about why things cost what they do, especially here in Beverly Hills. But there is going to be some variability, and that may impede, the choices you make of plastic surgeons. But as long as you like their results and you like them, don't worry so much about maybe they charge less than someone else. Does that mean they're not as good? Not necessarily. It just might mean that that's their fee.
Yeah, I mean, my fees are on the high end, I think. I've heard prices higher from a few people, but...
Well, let's talk about that, because we don't want to be opaque. Like, let's talk about fees on, in 2024, coming towards the tail end 2024.
Yes.
What are the going rates in the country, and what are your rates here in Beverly Hills and in the surrounding areas?
I'm going to say mine first, because they always seem to hear the
they hear the others.
The patients hear the national average and go, "Oh, that's great."
Yes.
No, my fees on a primary rhinoplasty right now in 2024, we're in like August, September of 2024. The range is anywhere from $28,000 to $40,000 for a primary rhinoplasty. And a revision rhinoplasty could be anywhere from $35,000 to $60,000 or $70,000.
Right.
And if it's a cocaine nose that needs to be totally rebuilt and put back together, it can cost. It depends how many operations we need to do and how. And I don't take insurance. I just I will give you a super bill and an op note, and you can send it to your insurance and see. They'll give you the $600 or whatever, but I'm not doing that anymore. The insurance companies have failed in reconstructive surgery for me.
And everyone, but digress. So your prices reflect your standing as a premier rhinoplasty surgeon operating in Beverly Hills, one of the most expensive locations in the world. I think if you were to look at similar practices in Beverly Hills, you'd find similar prices.
Yes.
People who maybe don't have as much, standing in terms of your rankings may have a little bit lower fees, but they're still going to be high. I think if you're looking at Beverly Hills as someone who does primary rhinoplasties on a regular basis and do a lot of them and do them well, you're looking at easily in that $20,000 to $30,000 range for our primary rhinoplasty.
Yeah, I mean, that's basically what it is now in Beverly Hills.
Yeah.
I mean, all my colleagues that do a lot of rhinoplasty, that's what they're charging. And the revisions are more expensive. They really are. And they take a lot of time. They take a lot of resources. There's a reason that my practice can function the way that it does. And, we are just in a very high rent district. Our nurses get paid a ton. Like, I think...
Rent is a lot.
Everything's a lot.
Anesthesia fees are a lot. It's a lot.
But, the thing is that people want their experts in Beverly Hills.
In Beverly Hills.
They do.
Now, you can find amazing rhinoplasty surgeons at other parts of the country. And I don't want to speak to what they cost because I don't know those markets. They may be less. Other parts of the country, New York, Miami, may have similar prices.
Probably similar to this.
Don't take our word for it. I don't know what they charge. Here, Beverly Hills, J. Calvert, these are the fees.
Yeah, and I think New York is more expensive.
I'm sure it's more expensive.
New York's crazy out of control with the costs. I mean, it's up there.
Yeah. Okay, so you've chosen your plastic surgeon, you've gotten your price quote, you've taken a gulp, and now you've decided to proceed. I remember you told me you had a patient once, and she was like, I just need a minute. Once she heard the price quote, and she took a minute, and then she said, okay.
Yeah.
Here we go. Here's my checkbook.
Just gonna take that in.
Take that in, and then here we go. And so now you have gotten your surgery date. Now what? Now what do we do?
Well, there will be a pre-op visit. So you're going to come in, and you're going to have a one more visit before the surgery where we'll go over everything again, make sure we get the details and finer points done. And by the way, you can bring inspo photos at the first meeting. You can bring them at the second meeting. I like to see what you think is, this is, hey, I think this would be great for me, or I don't like this. Anything that you can kind of give me the idea of what your aesthetic is that you're looking for is really helpful.
Really helpful. And this is the time frame between your consult and your pre-op where you and the patient have a plan. You have to come up with a plan. It's nice for the patients to be able to articulate to you what they like about their nose, what they don't like about their nose, what they want to change about their nose, and also be able to show you even some of your own befores and afters of what they like. Because
Very helpful.
more than many other surgeries, rhinoplasty is a very unique aesthetic. And every patient, every doctor has a different look they like, and you can adjust the final aesthetic based on what you come to an agreement on. And this is the time to discuss that and flush out. So you're coming into the surgery with a common goal.
Yeah, and if there's airway problems too, I want to talk about those. I might want to get a CT scan to look at the sinuses, the septum. I might want to look at the bony anatomy. Like if there are any issues with breathing through the nose or a history of trauma, and we have a whole trauma podcast because trauma makes the operation very different.
Right. It almost becomes a revision rhinoplasty.
Yeah, it's a very different operation when there's been a nasal fracture. It's not just a little nose job now, which there is no such thing as a little nose job. I think every rhinoplasty to me is an opportunity to be awesome, and they're hard, and there's no easy rhinoplasty. I don't ever I say a prayer every time I walk into the operating room. There's so much that goes into getting a great result in rhinoplasty that I don't know how anybody could look at a nose job and be like, this is a chip shot.
No.
It just isn't that way. It's somebody's face, and I am like on it in every way when I walk into that OR.
Right. And so they've trusted you. You come up with a plan. They're coming up to their day of surgery. What do they need to prepare? What do they need to know going into the day of surgery?
Read the instructions.
Read the instructions. Wait. We have a podcast about this too.
Read the instructions.
Read your post-op instructions before you have surgery. Listen to our recent Pitfalls and Pearls podcast where we talk about this ad
So
nauseam.
true.
You will get a deluge of information at your pre-op appointment through emails and through paperwork. Read it, because that's when you're really going to understand what you need to do post-operatively. And this is the time to ask questions. The day of surgery, when you're coming in to have your surgery, is not the time to go over the whole plan, and change things or ask questions. I mean, it is. You definitely want to ask questions before you go back, but you should have a good idea before that day of surgery comes around about what's going to happen and what's the plan for after.
100%. And, and then just you got to trust the process. You're going to be down for the count for about a week as a patient. And, sometimes if there's a lot of airway work, then I'll have internal splints. You're going to have splints in the
Inside,
nose that are sutured in place. They stay there for a week, 2 weeks if there's a lot of septal work. You can breathe through them. I don't use packing. I find that medieval. But one patient gets packed about every 5 to 6 years because they just bleed like crazy. So if you're bleeding like crazy, you may wind up packed, but it's very rare. There'll be a splint on the outside. If I've taken a fascia graft, there might be some stitches on the side of the head. If it's a primary Asian rhinoplasty, I might have done a rib graft. So all those things will be discussed prior to the operation, and you'll know what you're up against in terms of post-op care. And there's this myth on the internet that you have to sleep in an upright position in a chair. You don't.
You don't. A little reclined is nice. It helps with the swelling. You don't wake up like super puffball, but you also kind of need to sleep. So if you're having difficulty sleeping in a super reclined position, then don't. Just sleep in enough of a reclined position that you can get the swelling out overnight, but that is not uncomfortable. If you can sleep for 8 hours upright in a chair, great. I can't.
I don't know why you need to do that. It doesn't say that in the instructions.
You don't need to. Read your instructions. Follow them along. That first week, just plan on being down for the count, taking it easy, having your little space at home to recover. Listen to your doctor, follow their instructions in terms of what to eat and your medicines and all of that stuff. And then at a week, usually that's when your splints come off. Like you said, sometimes 2 weeks for the internal splints. But after about a week, the splints come off, the bruising's coming down. You can start to venture back a little bit into life.
Definitely. And I get people back to exercise after 2 weeks. I could tell them, just do it light. Don't go crazy. By 6 weeks, they can kind of do everything, except I don't really love running with rhinoplasty till about 3 months.
Okay.
They can do it if they're like a crazy runner type, which I have those patients,
Sure.
then, I let them do it. But I just don't love the pounding on the pavement
Yeah, I
with
can
the
see that.
rhinoplasty. It's okay, but, plan for otherwise if you
Plan
can.
for otherwise, and plan your life, plan your family. You know, if you're a mom with a couple young kids, like just plan on someone else being around to take care of them. This is not the time to get whacked in the nose by your child sitting on your lap, you know, or something like that. So just plan on having some extra help if you have responsibilities in the house, because now is not the time to be a super mom. Like you're going to need a little bit of help.
Yeah, and just understand too that it does, like when the splint comes off, it's not the best day of the year for that nose.
No,
it's
it's
going to be a
not.
little swollen.
You're going to be swollen. And depending on how much work you had done and what number rhinoplasty this is for you, will determine how much swelling and how long it takes.
Yeah, I mean, there's a lot of, like I had a patient the other day that said, well, how come on so-and-so's Instagram, when he takes the splints off, the noses look perfect and there's no bruising and no swelling? I was like, that's because he's doing it at 1 month after surgery. And I said, that's not an honest result.
That
And
is not.
so you have to kind of understand, like, that's why if you go on my TikTok and my Instagram, I have patients like, here's a patient at 1 month, at 1 week, and they look, appropriately swollen and bruised. And I said, here's two weeks, and here's 6 weeks. And I think, you just have to kind of get a feel for the fact that you'll be fine, but you're not going to be ready to go get those new headshots for about 3 to 4 months. That's
Absolutely.
really what it takes for a primary rhinoplasty to calm down and look good, but then it'll get even better after that.
It'll keep getting better. 6 weeks is like, meh, you're kind of there. 3 months, you're really starting to see the shape and the structure come in. But if you have thicker skin, it's going to take a lot longer for that swelling to come out and to start to see the actual definition of your nose. So yes, 3 months, you can take some photos. You can wait till 6 months for the professional headshots. That'd be even better. But really even a full year until you really see a lot of that swelling. This is for a primary rhinoplasty coming out and really showing the final shape of the nose.
Yeah, I know we're coming up on a 1 year mark for one of our nurses, and her nose has been it's been good, but it really got good over the last few 4 or 6 weeks, and it's still got a little ways to go, and it just keeps getting better and better because that's when the contraction really occurs, is the 9 to 12 month part of the year, and it's you got to kind of give it its due. It deserves it, especially before you start kind of judging the final result, because it's not quite there until then. Now, granted, if there are problems along the way and we can do something about them, I'll jump in and take care of it. Those are pretty rare, but they do come up. And again, the revision rate on primary rhinoplasty, the national average is 15%.
It's a very real number.
That's a lot.
Yeah.
It's not my average. We've analyzed my practice recently. One of the fellows, Dr. Safran, came through. He says your revision rate is lower than the national average. I'm not going to say how much lower, because if it's you that needs a revision, it seems like it's 100%. And I still revise primary rhinoplasties of my own. It's comes with the territory. But it's usually the things that need to be done are pretty small and minor,
Right.
and they can be done under local anesthesia.
Right. There's a range, a spectrum of revisions. It could be a small little ditzel thing all the way up to a rib graft. So just because someone says, oh, it's a revision, doesn't necessarily mean that it's a huge undertaking. No. It can be, but hopefully it's just something small, which is very normal. I mean, trying to get all of these structures to heal and the skin to contract a certain way when you've moved all these parts around, it's asking a lot. So it's not uncommon to get a little something that may need a little touch up here and there.
With that said, 9 out of 10 times it is one and done. So that's the good news. But the reason that you go with, somebody who does a lot of this stuff is, I have a system for those revisions that works and it gets things taken care of. And I can tell you, it's as frustrating to me as it is for my patients. Well, it's probably much more frustrating for the patients, but it really does frustrate me when things aren't right. It gets me, and you're the same way. It's just like, why, what? But I did this and I did that, and you can't anticipate how people heal.
Right. And what about the breathing? So someone comes to you with a breathing problem. When can you expect that will improve?
That's usually 3 to 4 months after surgery. Even though the airway will be opened up and better, there's a lot of swelling and things have to, your nose has to kind of reorient itself.
Right.
And the turbinate cycle is thrown off by swelling. There's a lot of problems just with doing surgery on the nose that makes it not that functional of an organ right after surgery. It does return, but I tell people 3-4 months for primary, and in a revision situation, it can take up to 8 or 9 months before the airway really kind of clears itself and adjusts and settles, because it's just a very difficult part of the operation. And I will say this too, that if you have a bad airway before surgery, it's a predictor of a bad airway after surgery. And typically, if you're going to have a revision in those situations, it's because the airway could be better.
The airway. Yeah, that's the number one reason a lot of people have a revision is it's for the airway. It's not the aesthetics. People usually are pretty happy, but the airway is the main reason a lot of people end up getting revisions.
Yeah, in my publication on revisions of rib grafts, where I revised rib graft patients who are done elsewhere, the main reason for revisional surgery was the nasal airway.
Right.
There was, I think we had 47 patients in that study, and 11 of them needed reoperation, which was a very high number. But we attributed that to the fact that they were a rib graft patient from somewhere else who needed further revisional surgery. And then out of those 11 patients that needed a revision, 8 of them were airway and septum based.
Yeah. So there you go. And usually the airway is good like right away after surgery. And then as more swelling goes on and things change, it gets worse and then it gets better. So everything that I'm hearing so far is it takes time.
Yes.
Be patient. It's swelling. It'll get better. Be patient. It's swelling. It's going to get better.
I say those words a lot to my patients.
A lot. I know. I want to get you for Christmas like a bobblehead of yourself and put a recording of you on it, just being like, it's swelling. It's swelling.
Yeah, I think somebody would smack that bobblehead right off my desk because they don't want to hear that. But it's the truth. So yeah, and that the reality is that most patients get their rhinoplasty. They're a little swollen afterwards. They understand that. They wait. 2 to 3 weeks after, they're like out rocking that new nose.
Oh, yeah.
Like it's like gold. And I'm like, it's not even close.
I know, but that's so true. At 3 weeks, we're like, oh my gosh, my new nose is so great. And we're like,
it's getting there.
They are so excited.
Yeah, but they're
especially
excited anyway.
For the big change ones. It's
for sure.
So exciting.
And somebody very close to me who had a rhinoplasty, who is an actor, got headshots like a month after surgery, and then like 3 months later didn't look anything like them. I was like, I told you to wait. I said, don't spend that money.
But it looks so good.
But they're so excited that their nose looks so different and better that they were like, I got to do it. But I said, you got to wait because they're going to, and sure enough, at the 4-month mark, it was like so much better.
Back to the studio we go.
So much better. So be patient. It does mature. It gets there. And then once it settles, then it's gold. And it's not to say that your nose won't change, but the way that I do these rhinoplasties in an architectural manner with a lot of grafting to hold the shape, they do hold up over time. And I think they look good at a year, but they probably look better at 2 years.
They hold up, for sure.
Yeah. You've got one holding up right now.
On my face.
I know. I'm looking right at it going like, that's holding up really well. And we've got the before photo right there. When are we switching that out? We need to talk to somebody about that and get the updated version. Yeah, that tip was different.
It was out there in space.
It was good. It served you well for many years, and now you have this one.
Yes.
All right. Well, I think that's kind of all the stuff you got to think about in the initial round, and then you can dive deeper. We have plenty of podcasts on rhinoplasty that you can dive as deep as you want on this stuff. You can get into trauma. You can get into septal reconstruction.
Nostrils.
Nostril asymmetry.
They will be different. Period. End of story. Next.
Your nostrils are going to be different. I don't care. You can now. They shouldn't be too different. So, like, I will go there with my patients on nostril asymmetry if they really look very different. But I do remember one patient wrote me a 1-star review on Yelp who had nostril asymmetry that was so slight, it was 1 millimeter. And she was beautiful. And she had a great revision rhinoplasty. Like, her befores were a disaster. And, like, I finished up in this amazing nose. And she wrote this like scathing review about the nostril asymmetry that brought me so many patients because her nose looks so good. And people were like, oh, that girl crazy. Look at her nose. Can you do that for me? It's amazing. I want that. And so like nostril asymmetry, I get it. Everyone wants to be symmetric, even though there's nothing on your body that's symmetric. I get it. So the nostrils just have to look like they go together. They don't have to be symmetric. Just you can look at my nostrils and they are not symmetric.
Nope.
Not symmetric at all. Nope. Now, this is a rugby nose, so we have to go with that. But at the same time, if you're sitting here looking at me, you're not going like, What happened to his nose?
No.
It's not.
It's not a thing.
It's not a thing. And my nostrils are really different. Yours are not as different, but
Mine are
but
pretty
they're still different.
Pretty symmetric.
Yeah.
But that's a podcast. Revision rhinoplasty is a podcast. Rib grafts a podcast. Post-op instructions, pre-op instructions. Go.
It's all there.
Check it out. But this
We've got
is
lots of
your what to consider when considering plastic surgery podcast.
I think that's all. I think that's good. I think that's a good starter kit. Yes.
Caroline, yes? Okay.
All right. She's cool with it. Well, in that case, then, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.